Hi, I'm Dr. Cohen. The purpose of this video is to talk a little bit about the options related to both breast lifts and breast reductions. I combine these procedures because they're fairly similar in the way the scars are and the way the patient's recovery process goes. Most women who come in for reductions also need a lift. Not everybody who needs a lift requires a reduction. Reductions are extremely popular procedures. They're often covered by insurance. People come in complaining of neck, back, and shoulder discomfort, and they complain of notching of their bras, straps on their shoulders, inability to buy clothing, just the opposite problems that women who come in looking for breast augmentations. Women who come in looking for lifts are not necessarily plagued or bothered by breasts that are too large, but rather breasts that are too dropped. But for most of those women who cannot achieve lifts with implants alone, the scars are the same. The scars for breast reduction surgery can be seen on pictures on the website, but basically they are an anchor incision around the breast. So effectively you have an incision around the areola all the way around the outside, typically resulting in a smaller areola for most people, a vertical scar which is up and down, and in many women a horizontal scar which occurs in their crease. So it looks like an anchor essentially. The scar is the same whether you're doing a breast reduction or a lift. The degree of scar typically is a function of whether you're doing a reduction or a lift and how much of a reduction that you're doing. The differences are in a reduction is that you're taking out breast tissue as well to make the breast smaller. But typically with a breast reduction you're going to have breasts which are higher and more youthful in appearance. What are the risks and complications associated with breast reduction? I think it's important to know. The biggest turnoff for most people are the scars, and I think that's something to think about. Scars are there permanently, and once you do it, they're always there. Now they tend to fade away over approximately a year to a year and a half, and they just take that much time to burn out. Virtually everybody that I know who's had a breast reduction said it's one of the best things they've ever done in their life because of the ability to buy clothing, because of the improvement in neck, back, and shoulder pain, fungal infections underneath their breasts, ability to buy clothing, just the ability to exercise and lose weight. It's a terrific procedure. In many cases, insurance will provide some coverage both for the facility as well as the doctor. The recovery is remarkably simple for breast reduction. There's just simply not a lot of pain, although you might think so from looking at the scars. Most of my patients are back to driving at day 3 or 4, exercise at day 10 to 14, and really pretty much back to normal in both their breast shape and what they want to do by 3 months. That is with the exception of the scar, which I said earlier takes about a year. The risks of surgery are fairly few, but you need to know what they are besides the scar. You can lose feeling to your nipple and your entire breast. You may not be able to breastfeed. The technique that I use, which is typically for 90% of patients a central mound breast reduction, will give you the most ability to breastfeed, but there are no guarantees and you really won't know until you try. You don't know who's going to lose feeling to your breasts, and that's just something that is a risk of the surgery, unfortunately. And finally, you may have some asymmetries, and there could be some wound healing problems, which are typically minor in nature. There are some patients who are going to have more significant wound healing problems, but we can generally get everybody cured and healed, and we can generally get every wound closed pretty rapidly. Most people are back to their normal activities of daily living very rapidly, and the surgery is done as an outpatient. So I strongly encourage anybody who's been thinking about breast reduction or lift to come on in. Some people who want to lift will benefit from breast augmentation, and if you are not sure, I would encourage you to click on the icon for breast augmentation, and some people in fact will need both. What I will tell you is that the studies have shown that women who do need both will often do better staging those procedures anyway, because for reasons of so many moving parts, the women who get both breast implants and lifts at the same time will sometimes need more operations to get it just right than women who do it in 2 steps. So if we're not sure whether an implant alone will take care of it, we'll do the implant first. If it's obvious you need a lift, and the implants will certainly not do it based upon the amount of droop, we'll do the lift first and then bring you back and do an implant later. There are some patients who can get away with lifts that just leave you scars around the areola with an implant, but that requires an independent consultation. If you're unsure and if you want to question that and don't want to come in, please send me a JPEG picture electronically to bcohen@totalskincare.com. I don't want your face in the image. I really just want a picture of your breast, and I can give you an idea of whether or not an implant and a lift will be appropriate for you. So sending me a frontal view, a side view, and a 45-degree angle view will allow me to determine that instantaneously, and I'll be happy to get back to you. The procedure is again done as an outpatient. We typically do it here in-house in our HHC Medicare approved surgery center. The patient satisfaction rate's huge, and we do a lot of the surgery. I'd love to meet you in person.